Good afternoon and welcome everyone to this webinar on the future of medical diagnostics and technology. I'm Dr. Arjun Mahapatra, Executive Director, Grid Council, your moderator for the day. Through some engaging insights from our esteemed panelists today, we shall understand how the future of diagnostics is being shaped with the increasing use of technology. As we see it, diagnostics are evolving rapidly with the use of technology. And of course, that goes hand in hand with the increasing needs for healthcare. Now, moving in the direction of automation, powered by artificial intelligence and machine learning, and of course, data analytics, technology assures precision and pace, especially when we look to the future of diagnostics. The pandemic, of course, has proven that the demand for laboratory testing and diagnostics will keep on growing. In fact, the Indian diagnostic industry has been valued at an INR of about 675 billions. And this has been projected to keep on increasing at the rate of 10% per annum for the next 5 years. The need of the hour, of course, is investment in the most competent technology and infrastructure that will aid pathologists in quicker and more accurate diagnosis. With the right technological investments and practices in place, diagnostics and healthcare will reach the projected transformations successfully, and that's what we hope for. To discuss this particular roadmap of technology transformation in diagnostics and the various driving factors around it, we are organizing RISE, an exclusive webinar brought to you by Worldline India. It's India's leading digital payments company and Economic Times Health World, that is ethealthworld.com. And I take the pleasure in introducing our panelists for the day. We have Dr. Harsh Mahajan. Sir is the founder, director, and chief radiologist, Mahajan Imaging. He is an eminent radiologist and a pioneer in the field of medical resonance imaging in India and abroad. Sir has received several accolades in the national and international space and plays pivotal roles in several committees of impact. Welcome, sir. Next, we have Mr. Dinesh Chauhan. He is the chief executive officer for Diagnostics. He is a microbiologist who has been in the leading business roles in the diagnostic industry for more than 25 years now. At Core Diagnostics, he is focusing on high-end, next-generation diagnostics that could be used for disease stratification and therapy selection. Welcome, sir. Next, we have Mr. Saugar Chatterjee. He is the CEO of Apollo Preventive Health Check. He shines in multiple roles, that of a healthcare strategist and a leadership mentor. He's a thought leader when it comes to the issues of the healthcare industry in India and beyond. And it's very easy to discover his writings on the internet. Welcome, sir.
Pleasure, Dr. Mahabat.
Next, we have Dr. Arjun Dang, CEO of the highly acclaimed Dr. Dang's lab in Delhi NCR. He's an MD in pathology with advanced specialization in liver pathology from King's College Hospital, London. He has been widely recognized and awarded for innovations during the COVID-19 pandemic. He's also the winner of the Business World 40 Under 40 in healthcare. He handles strategy, operations, patient experience, and staff trainings at Dr. Dang's. Welcome, sir. And then we have Mr. Ramesh Narasimhan, CEO, Worldline India, which is a leader in the payments industry in India and globally. He has over 32 years of leadership roles in several businesses, and he has built businesses right from scratch and then scaled up across verticals and geographies. Welcome, sir. Welcome.
Thank you.
Once again, hearty welcome to all the panelists, and let's get the discussion started. Mr. Ramesh, I'll come to you. Let's start this discussion with your inputs. As we know, the role of technology is rapidly evolving in the medical diagnostics industry. And you have been very active in this industry. So I'd request you to give an overview on this, especially on how digitization is revolutionizing the consumer experience and behavior, and what growth triggers you see that exist that would drive the digital diagnostics to the next level.
Thank you, Dr. Mahapatra, and hello and welcome to my fellow panelists. It's a great question because digitization is all pervasive in our lives today, whether it be ordering things at home or the education, or even doctor's consultations, and you take everything, payments, everywhere, digitization is the order of the day. And The pandemic has ensured, many of the services that we are used to have now become digitized. And, as a whole, we're also very comfortable with it, and we're, leveraging, as it drives a lot of efficiency. Digitization does do that. Now, coming specifically to a question on what are the triggers that exist that can drive digital diagnostics to the next level, I see two triggers. And the first one I see essentially has to do with data standardization, right? I mean, you have, as I said, the rise in digitization, digital diagnosis, prescriptions. These are all revolutionizing, patient experience, by providing very convenient and personalized approach, regardless of location. During the pandemic, we've all done that. We've been there, we've done that, had a discussion with doctor, diagnosing our, whatever healthcare condition we have. And this has happened because of the stress on medical services because of COVID-19. We started using, online channels to book appointments. We had, diagnostic line come to our home, collect the sample, and then publish the results to us online, and also doctors prescribing medicines online, right? So now, when you have all these things, it's very important that for these services to scale up and be interoperable, it is necessary to establish standards for a unified digital health system, right? And the government unveiled something called the National Digital Health Mission. It's a right step in the direction as India begins to leverage these things in a digital format, right? And you have to do essentially standardize on formats that can simplify access to data across public, private, hospitals, healthcare clinics, diagnostic centers, and with suitable data protocols and standardized formats, electronic health records can be migrated across various health touchpoints, right? Ensuring that doctors have access to the right diagnostic data to be able to provide timely and care to the patient. And if you look at it, India as a country, we've done some of these things at a massive scale. The first one, if you look at it, is Aadhaar itself, which is the backbone of some of these things that we're talking about, right? Today, we can say that more than 1.2 billion people have Aadhaar records in India, which we have leveraged to set up a wonderful platform called COVID, and it works to deliver especially in the era of COVID pandemic, to deliver reminders to you to take your dose, to help you book an appointment, and to also, I was pleasantly surprised. I received a SMS saying you're ready for booster shot now, and I actually went and took the booster just last week. And getting this platform ready is probably one of the biggest things that we could have done as a country, and the platform works, right? Brilliant. So this is one thing that we've done at scale, right? And then if you take things like FASTag, today, all of us, when we drive down to work, we used to play multiple toll booths, money. Now you have a single standardized FASTag that you just drive through, right? So when you standardize, data standards is very important for us to build scale and make it efficient and, make it easy for people to avail those services. Take payments itself. I mean, credit cards and debit cards were the privilege of the people who had access to banking. Today you have UPI, and you have everybody who can access digital payments. I live in Mumbai, and the person who comes to deliver, eggs and bread in the evening says, "Sir, UPI mein pay kar do." Whatever name he calls it, Google Pay did them. Which means now he has access to a bank account and he's able to take payments electronically. So, we've seen this revolution happen in front of our eyes, and that's why data standardization is important. And along with it, especially any data for that matter, it's important that we secure this data, and so data protection, data security, individuals' medical history, these are not to be, publicly made available. It's supposed to be secure, stored, can be only accessed by, professionals who need to access it to, like the healthcare professional or a doctor to be able to give, the right diagnosis. Similarly, so it's important that we gain the confidence of all stakeholders, whether it be as citizens or patients, medical fraternity, government, and even support ecosystem like insurance or infrastructure providers, right? All these people are important stakeholders in this. And this is what I think is a very important trigger, which is data standardization. Right? The second one, which I'll talk about again from being from the non-medical fraternity, talk about how these delivery mechanisms are coming into play for the enhanced reach and convenience, right? Today sample collection is done at the doorsteps, right? And the good part is the laboratories are able to even collect money at the doorstep thanks to digital payments, right? But really, as you go forward, the technology like drones, which will come in and revolutionize how we can deliver medical services in remote locations in our country, right? Or collection of samples. This is one that can take us to the next level in terms of our, being able to provide medical services to far-flung areas, right? How can we provide, some kind of, using the bandwidth that we have today on our mobile phones? Can we provide the ability for a citizen to get medical advice from a doctor in a different city, which is already happening but needs to be scaled up again, right? And lastly, if you ask me from a technology perspective, the other trigger could be wearables. Today we all have watches that no longer are watches. A watch is now, a device that collects a lot of data. Though a lot of us still wear watches as a jewelry piece or something like that to tell us the time, right? But watches or wearables is the next thing that will, I think, be able to collect a lot of data. And with the advent of 5G and what is called as IoT, Internet of Things, it will be, I think, this whole industry of collection of data, diagnosis, medical industry will be one of the big industries to be we'll see a benefit of data which is coming directly from the patient and be able to provide much greater much better access to real-time data to provide the right diagnostic. So at a very high level, that's how I look at it, Dr. Mahapatra, but there are experts on the panel who will probably decode and tell you how to use the data and make the best use of it.
Thank you, Mr. Narasimhan. You touched upon several aspects of it, and of course, this triggers a very wide discussions now on that we have to interact with the panelists. I would now go to Dr. Mahajan. Sir, you have been in the industry for so many years. You have seen it evolve. Now, when the COVID-19 shocker came to us, we always thought that possibly maybe the system has the resilience or not to handle this kind of a calamity. But of course, the system has come out winning. So it has been resilient and at the same time has shown the potential for rapid scale up. As Mr. Narasimhan was also mentioning, the COVID experience, the rapid scale up of the vaccination for COVID has been exceptional. We have not only ensured that tests are available, but tests have now penetrated. So contactless sort of sample collection and delivery to the patients. Now, of course, there are learnings coming out of it. So what learnings do you see that have emerged from this pandemic experience? And especially that the diagnostic service providers should notice and take forward and, if needed, even further improve upon.
Thank you very much, Arjun, for having me on this panel. And as has been said by Ramesh and you yourself, what this pandemic taught us is that we have the resilience, we have the capability, we have the ability, and we have the muscle, which maybe we were not aware of, to scale up, to grow, and at the same time to provide and keep providing quality. With this rapid scale up that happened, also what the pandemic showed and showed very well, something which people believed, and we maybe in the industry and the government on its side believed could never happen, that the public and the private sector can work hand in hand, can strengthen each other to achieve the goals that the country needs, to achieve targets that the country very direly required. And because we've been able to achieve this is why we are in a relatively comfortable situation at the present point of time, where we saw that from a handful of labs capable of doing RT-PCR testing, the gold standard, I mean, now I think even in the rural areas, they know that there's something like RT-PCR, which actually molecular diagnostics was thought to be the very highest end of lab diagnosis. Today, there are thousands of labs in this country which are able to do it. From a few hundred tests that we were capable of in April, May of 2020 at the beginning of the pandemic, today we can easily scale up to 2.5, 3 million, and we would still have balanced capacity left in the system. That is as far as the pathology labs went. Also, there was not a single RT-PCR test that was being indigenously manufactured in 2020. We saw that the medtech sector rose to the occasion, and today we have nearly 150 accredited units in the country which manufacture RT-PCR and other allied tests. Something which, possibly if you asked me in January 2020, most people would have said, hey, it's just not possible. But we found that within our own system, our entrepreneurs, our startups, our established labs and medtech companies found that innate capability. And today, not only do we make in India for India, but we are exporting to the West. At the same time, let me talk also of the textile industry, which not a single, quality mask, let alone a full PPE kit was manufactured in the country. Today, it's a $1 billion industry and maybe more, and we export to other parts of the world. Had this not happened, you would not have had the people from labs coming, wearing a RT-PCR outside your home, coming into your home and picking up a sample. It would just not have been possible. You would have had to go to the labs where, with the deficiency of PPE kits, that same person could have taken 100 samples, 80 samples a day, instead of being able to go to 25 different locations, wear a new PPE kit 25 times, and then be able to collect your sample. Then let me talk also about genome sequencing, which again, there were just a few labs in the country, both in the private sector. We have Dr. Dinesh here from Core Labs, who have the capability at our own margin imaging. We were capable of doing it, but there were a handful, and mostly doing genome sequencing for cancer. These have now transformed into labs, and a large number of them in the government sector, which are capable of doing next genome sequencing for determining whether there is any change happening in the virus, from the Wuhan virus to the Alpha, to the Delta, to the Omicron. It's possible only because we have next genome sequencing here, and INSACOG, a collaborative set up by the government, has 38 labs from the government sector, 6 labs from the private sector, and proudly we say that we are one of them. And so, if it is from Omicron, it is becoming Omicron .2.12.1 or some other change, whether for the better or the worse, whether it's going to be more virulent or more contagious, that can be known only if you do next-gen sequencing. And here also the countries capability has risen many-fold. Talking about my own personal field, radiology, and we know that both the chest X-ray as well as in the moderately severe and severe cases, the chest CT scan was very essential to be able to know before things went bad, before someone needed to be put on a ventilator, that can we do something so that he doesn't go on a ventilator. There again, and here not only our radiologists, our pathologists rose to the occasion, but even think of the service engineers, who were going into COVID hospitals because something went wrong with a CT scanner or with the RT-PCR machine or with some other system which was in use, an X-ray machine, because not only were they being used, but they were being abused, used round the clock. And so things failed. And even these engineers, despite, what their parents may be telling them, mostly young, that why do you need to go? But I can tell you, the industry as a whole, not only the diagnostics service providers, the hospital service providers, but the medtech industry, the startup industry, all rose to the occasion. And again, a point about what Ramesh said, digitization. In radiology, we've always been digital. In lab medicine, digitization happened years ago. And this really helped. Even the WhatsApp, which, when someone puts you in a group, you say, what the hell, another one. But during the pandemic, they were taking videos off the monitors, and radiologists sitting at home were able to write out the reports and send them back. And we know the CT value on a number was very, very helpful in differentiating mild disease from moderate and severe disease, and hence determining whether a patient needs to go to a hospital or can be treated at home. You would see the switch that happened. In the beginning, when the pandemic started, even those who were asymptomatic, those with mild disease, were being admitted in hospitals. Whereas in the second wave, when we had the Delta, it was only the serious, whose oxygen levels fell, whose CT scan showed that there was significant disease, who were being admitted. And so we've seen this transition even in treatment happening. And then the use of telemedicine. Now, credit to the government that in March of 2020, they came out with the draft regulation. Before that, it was illegal to practice telemedicine in this country. And that helped, especially during the second wave, when, hospital beds became scarce, were reserved only for the serious patients who required oxygen or ICU care. Here, telemedicine played a major role, and, to be able to provide home care companies came up. So it wasn't just the diagnostics industry, the entire therapeutics industry, being able to provide care at home has come into its own. And the learning, if you ask me, has been that we have the capability. Learning for telemedicine has been that for doctors like me and other physicians, that even if you are not able to encounter the patient, keep your hand on the patient, hear through a stethoscope, using the tools that you have, we are convinced now that even significant illness can be treated. Mild disease can be treated very definitely, remotely. And for the patient, also, since there was no choice on both sides, they've also realized that we can actually be treated through telemedicine. And you see so many startups coming up. Someone that I'm associated with, Meradoc, worked very well during the pandemic and worked free of charge. And you have to believe me when I say that many doctors worked free of charge, providing their expertise online. and not charging, because if you remember, a prescription was a must for you to go and get an RT-PCR test done. So that has been a learning. Also the fact that you can now test at home. The home kits that have come into their own may not be as accurate as a RT-PCR test, but if someone has significant disease, has significant viral load, then these tests are helpful. The bane has been that those same prescriptions were floating around on WhatsApp, and many people were self-treating and getting tests done which were not necessary, getting CT scans done which were not necessary. And so many times we had to actually argue with people where the whole family would come to get a CT scan done, young children with hardly any symptoms. And so that has been a bane. Self-prescription and using that same prescription without actually talking to the doctor has been a bane. And these are issues that we will have to overcome as we go forward. But there have been huge learnings. The major thing being that India is capable, that the public cooperated as much. Because remember, if you have disease and you're going around in the community, you will spread it. And so there was self-discipline also shown. People took government notifications and government advice at face value, despite the fact that at times we tend to be very nonchalant about it. But during this pandemic, we found that we were a reasonably disciplined lot. And also for the medical fraternity, different ways of diagnosing, different ways of treating, which will, I think, lead in the future, in the non-pandemic world, to use of telemedicine to provide access to far-flung areas, expansion, scaling up of diagnostic services in tier 2, tier 3, tier 4 towns and cities. So access provided with quality. Of course, one a negative that we found was that in every state, in every district, you had to go separately, seek permissions, and that's something I think that needs to be rectified, where if the central government mandates something, then at every individual level, permissions should not be sought, and there should not be, because that delays the entire process and also makes it non-uniform. We saw states which did very well, and we saw others which didn't do so well during the pandemic. So we have to learn from each other. And just as ICMR became, the central agency which was giving guidelines, I think that should continue even in the future when we talk of infective disease or non-infective disease, be it cancer, be it heart disease, be it, stroke, or what have you. So there have been huge learnings, and really, I think what may have taken 10 or 15 years for transformation in healthcare, for digitization in healthcare, for new trends emerging in healthcare has been shrunken into 2.5 years. And AI, I think Arjun is going to talk about that, so I won't delve into that. Thank you very much.
Thank you, Dr. Mahajan. While narrating the surge, preparedness and response in India to the pandemic, you touched upon issues which were cross-cutting. So not just the whole of government, the whole of society, the whole of industry, and of course, many sparks, many promising sparks and inherent strengths that we have in our approach to disease and discipline have been uncovered. So people have risen to the occasion, and that's been like across different stakeholder constituencies. So a very fantastic elaboration of the learning, sir. And now, as we move on with the discourse, there are elements that you mentioned, and some have been very validated. For example, the technology front in diagnostics, and some startups and entrepreneurial skills have also been established in the country. One thing that I observe is the emergence of AI/ML, so artificial intelligence and machine learning, and that has also been adapted to the diagnostic front. So, Dr. Arjun, I'd like to request you to reflect on this. Like, how do you see that AI, ML, and technology is transforming diagnostics? And how is this unfolding? And do you see any particular challenges and opportunities going forward?
Thank you, Dr. Mahapatra, for that question. And also big thanks to ET Health World for having me on this panel, very prestigious panel that has such stalwarts in healthcare and other industries and such eminent speakers. Absolute pleasure to be here. Yes, so the way that I see adoption of tech and AI unfold in healthcare, so it's very clear that it is going to increase accessibility. It is going to lead to more collaboration in the healthcare fraternity itself. And ultimately, it's going to lead to better healthcare being provided and betterment of the overall health of the nation. So that in a nutshell is how I see it unfolding, but it is not going to be a destination that we can reach. It's probably going to be a journey and an uphill one with a handful of challenges and abundant opportunities on the way. And when we speak about these challenges, what I actually feel that obviously, like what Dr. Mahajan sir was saying, that COVID gave all of us a push, and it was the silver lining in the dark cloud that made us realize that actually what tech can do, not only to scale, but also to keep delivering that precision and accuracy in our reports and how it actually helped us. But for a majority of India, where healthcare is mostly fragmented and in the unorganized sector, to adopt and adapt to technology is actually like changing the wheel of a moving car. So it is going to have challenges, but the one key factor that we can look at while doing this is very effective and clear communication of the vision to your team. So once the team understands that there is a tech piece to diagnostics that at the end of the day is going to give that value add to the patient, then the entire team is on board and that wheel of the moving car can easily be changed. So that is one challenge, especially in smaller organizations and in a country like ours. The second place where I see is now we have radiology that is leaps and bounds ahead in AI and ML. And also compared to pathology, we see a lot of more work being done in radiology. But I see one challenge there that for a doctor, a trained doctor who's an MBBS or an MD in radiology, for them actually to understand AI, although we do have a lot of people doing great work, but actually to carve out these kind of doctors from people who've done their education and training in the regular MD radiology field, I think that is a challenge. And to find doctors who are adept and understand both the tech side and the subject also, I think that is something that requires a lot of focus on training, education, skilling, and then also encouraging these doctors to further take that path and build teams to do something different and something niche. Again, another thing that I see that would be a challenge would be the huge amount of data that we have. The different formats, what we were also discussing earlier and Mr. Ramesh had mentioned, was that this data being in different formats. So this data integrity that we need, this uniformity across different platforms or different formats that is there, to have them in a uniform way will be a challenge, not only because of the fact that they are in different formats, but also because of regulations, because of data regulations, data sharing, patient consent, etc. So that would again be another challenge that we have. And obviously, the third and the most obvious one would be the dependence on the machine itself. When we talk about tech and when we talk about AI/ML, like I still remember that during COVID, there was one late evening when suddenly WhatsApp wasn't turning on. And it was actually disastrous because in those 15, 20 minutes, I received some 10 SMSs that how is this going to work and that going to work. So dependency is huge. So at the end of the day, that empathy and trust between a doctor and a patient, when you actually hold the pulse of a patient and look them in the eye, is something that should not go missing, and I pray that doesn't. And obviously, coming to the opportunities now, I think no time and words are enough to actually convey what a great opportunity it is for the sector and for professionals like us. Because for a country like India, and what has been spoken before also, the scale and the last mile delivery that we need to reach, there is no other way but to leverage tech to have this in the rural areas, also have accessible, quality, affordable healthcare for all. The only way is to reach through tech. Another one that I see here again, what Mr. Ramesh had mentioned is wearables again. So with wearables, the opportunity is so huge to convert the sick care that we currently run in, or have the format of sick care where only unwell people are looked at, and a majority of our healthcare spends is for sick people. It's more to well care. So that's with wearables, where you monitor your health, where you have constant know-how of how you're doing, how your trend is, how your body is doing, where you need the doctor's intervention. Also, only yesterday I read this article where it was very interesting. But there's a company that is incentivizing your good health in the metaverse, and they're giving you these tokens. And it was very interesting because it is actually flabbergasting that there is so much focus on well care, preventive care. So again, tech and the virtual world now plays a very important role in that. So keeping all this in mind, and again coming back to the use of AI and ML in diagnostics, I feel that it is a wonderful opportunity, but it has to be looked at with a lens. It needs skilled and trained doctors who know the subject, and also at the same time understand that piece of AI. Also, in pathology, I feel there is a lot of work that is being done in the AI segment, especially in the analytical phase, especially in cytopathology, histopathology, hematology, with automated analyzers and with a lot of oncology testing also in the analytical phase. So we have data sets that are created after studying morphologies, and then you have AI tools that triage the particular slide or guide the doctor about which slide needs their attention. So there's a lot of focus on that. But I think one thing that is lacking even in pathology right now, probably two things that I would say, is the pre-analytical and the post-analytical bit of testing. So when you talk about pre-analytical and how you can leverage tech there, I think COVID was a great example of that, with AI chatbots that guided you really that the cough you have can be COVID, and if you need a test, or how long you have to quarantine yourself, or exactly when you need to see a doctor, or the teleconsultation itself, where a diagnosis is made just by talking to a doctor on Zoom or any other platform, to the post-analytical bit also, where understanding reports, knowing exactly what are the action points in it, when you need to see a doctor, when you need to recheck or retest yourself, something that's very, very important. Again, I am going to conclude with a very interesting thought with all of us, that see, there is something that AI provides, but it definitely cannot replace the doctor. And a very key example of this is something that we have multiple projects going on currently, and it's a clinical decision making tool. So you take longitudinal data, especially in pathology, and with basic tests like chemistry, hematology, etc. You take this data and then you develop an algorithm that guides you about what should be done in the next months to come. So a simple example like diabetes. And if you have someone who has a trend where the HbA1c is increasing, then obviously that algorithm will be able to guess and predict that, okay, in 4 months from now, your glyco levels will be this much. So these are the lifestyle changes that you need to undertake. So it's more of this well care than sick care that AI and stalwarts in the tech space will guide us towards in the future. Thank you.
Thank you, Dr. Arjun. You provided a very strong vision into the future, and then the developments in the AML space, and also contextualize the challenges. And that too, giving very lived examples, lived experiences. So that was fantastic listening to you. Next, I'd go to Mr. Chatterjee. Sir, Dr. Dang just now spoke about the role of AI, the evolving role of AI ML in technology-driven diagnostics,
Right.
and that it improves access, and then there has to be some focus on quality as well. So, my question to you is: could technology help in improving the quality and access to diagnostic services for population at large, for a country as large as India, and then so much of resource inconsistencies? And what changes must happen in this space to facilitate the rapid expansion of tech-driven diagnostics in India?
Sure. Very valid. In fact, first of all, I thank all the panelists who have spoken so far. Very interesting and very valid inputs. And I think this is the need of the hour. And from ET's Health World's point of view, this endeavor to bring in the Diagnostic Summit. And diagnostics is not just necessarily a wing. It's one of the key elements of healthcare. And anything and everything actually evolves and revolves around diagnostics. So, considering the evolving technology in the healthcare and the way it continues to shape the way we provide care to patients, we have seen the advances in artificial intelligence, data generated by patients using wearables, smartphone technology, involvement of technology in multiple apps, which are the digitized health collaborators of various services and processes which they stand to deliver in improving the consumers and also the clinicians' ability to diagnose and treat the patients better. So, as well as while improving the quality and the safety of the care is important, what is also more important is to how to build up that efficacy. And of late, even the government of we have been talking about how to make a universal, affordable health care in totality made available to people mass across. Now, when it comes to affordability, while there can be a price which can be adjudged to the quality, or rather I would say the customer experience, that can come at a price. But when it comes to efficacy of service, that the only way that price bridge can be bridged and that can be taken care of is only through improving the technological impact. And when we're talking about a country as large as India, with a 1.3, 1.4 odd billion population and growing, there is no other alternative rather than enabling technology to its to the best benefit by which the clinical diagnostic process and how it can enhance the communication between the patients and the clinicians. To make this structure, when you say accessible across to multiple people across the country, it has 5 key drivers which effectively should make this thing possible. And I can just briefly explain to all of them just to kind of simplify it. The drivers would be effective teamwork, a reliable diagnostic process, engaged patients and family members, optimizing cognitive performance, and robust learning systems. Now, while each of this, before I come to the dimension of briefly speaking on all of the drivers, one of the key things which also is emerging, and that's how probably this is a thought which probably I wanted to share at the ET Health World platform on the Diagnostic Summit, right? A lot of aggregators and collaborators are existing in the marketplace, right? A lot of digitized health apps are there, which are benefiting through various kind of tie-ups with diagnostic services, diagnostic service providers. Every diagnostic provider service has a limitation. Now, no matter how much you do, you can never be having a manpower big enough to cover every length and breadth of the country. 2, this effectively the entire system works at a very typical FMCG market domination module, where you have areas, markets, routes, beats defined. And the same way, our diagnostic processes, the samples are getting collected from the households day after day. Now, there are various few simple but yet key challenges there. When I say simple and yet key challenges, I'm talking about 1, the timeliness. Because most of these tests, they require a particular amount of timeline for the sample to be made available at the processing unit. That's 1. 2, the holders and the devices in which you are carrying. Subsequent amount of costs on the kind of tubes and kind of I'm not getting into too much of detail on the kind of tube compositions, but then with the kind of tubes and the kind of holders which you're carrying, in which you're carrying the samples, be it the blood or be it the urine or be it anything for that matter, that also defines a lot about the efficacy. Third, and most importantly, at any given point of time, there is an amount of I would say, restlessness or probably a consumer expectation where they want to see things on a real-time basis, and despite of the fact that how many number of SMSs a consumer received, sample picked up, sample dropped, sample given. So while technology has done that bit, but then the consumer equally wants to know what has happened to my sample and so on and so forth. So the entire drive by which this mass effect can be brought in is where probably, I would say that the diagnostics industry in totality, they need to kind of come together to create some amount of unified processing units, which can be effectively used across organizations, whether be it A or a company B or a company C or a company D, which to a great extent will reduce the cost, enhance the time, and increase the efficiency of the tests. And collectively, it can be a very path-breaking, and then it left upon each to see what value addition each of the entities can offer to the customers. And that will be a different kind of a healthy competition where it will be value addition driven rather than somebody worrying that, whether my entity A will be a better efficacy giver or probably entity B would be a better efficacy giver. So that's one dimension which I wanted to talk about before I come to the 5 drivers. Coming back, and before I start off the 5 drivers, diagnostics being the key part of healthcare, and whether be it the in-hospital, outside hospital, preventive, post-preventive, educative, affirmative, or cognitive, diagnostic remains the cornerstone for connecting each one of them in its own total rights. So, very importantly, what it entails is an effective teamwork. And the teamwork refers to an enhanced level of skill and competitions, which are interdependent and also multidisciplinary, which also includes that the patients and families at the same point of time are equally competent or at least aware about the process that is happening. Similarly, the teams, they can apply safety culture principles and practices which are focused on active engagement of patients, caregivers, making explicit each team member's role and responsibilities in the diagnostic process, and therefore reinforcing this expectation throughout patients oblique the clinical visit, which is the most vital part. In the entire process, one of these key challenges which we need to overcome for a mass level of outreach is the skill enhancement of both people and the service provider, which starts from the phlebotomist, lab technicians, the clinicians, and effectively the report submitters. And when I say skill enhancement, I'm talking largely about the kind of competencies which each one would need to hold. Having said that, this is the area where we are still struggling because as we see budding diagnostic centers coming up across the country, particularly into the sub-tier 1 and the tier 2 markets, a lot of skills often get compromised, and effective control on the mechanisms to ensure that these diagnostic service providers are having the adequate skill level to service those patients. That is something which is a key process which can only help in ensuring a seamless and effective efficacy level maintained across in the services. My point number 2 was reliable diagnostic process. So when I say reliable diagnostic process, I'm talking about the process which describes the system of people and the processes and the environment in which achieving this accurate and timely communicated diagnosis is possible. Because every place when we go, and looking into a country once again as fragmented, as differentiated like India, where probably you have varied climatic, humidity, cultural, traffic, multiple things involved. I mean, even we cannot demarcate things like a tier 1 and a tier 2. I mean, probably a Hyderabad, Bangalore is a tier 1, probably a Delhi and a Mumbai also a tier 1 and falls under a metro. But probably to make a movement of 4 kilometers in Hyderabad and Bangalore, and the time consumed, besides making a movement in 4 kilometers in Delhi or a Bangalore, Delhi or a Mumbai, and a time consumed, are two very different yardsticks. So therefore, it is not just about the categorization of the areas. It's also about getting into those micro detailing as to how to enhance those. So specifically, this also refers to organizational structures which optimizes the diagnostic safety, clinical operations, and the workflow. So this actually supports the accurate and the timely clinical sample collection, information, and process. That is the only way to ensure that the accessibility to specialty and the expertise derived out of this significant number of transitions are made useful for the consumer. So at the same point of time, there has to be mechanisms for patients and their families to provide ongoing feedback about the diagnostic process. When I say process, this process is differentiated from the word, by which we say getting information as to sample phlebotomist has reached your place, sample deposited. That's update. But to know about the process, as to how the process is happening, what across the sample management program is, how the diagnostic process, even from the fact that pre and post, what have been the changes, a smart report to make the patient's life much more easier, so that they don't hover behind only reading behind the low and the high mean and median marks on the reports. That process needs to be reliably brought up, by which the larger kind of fraternity of our customers, they get benefited, and they're not mesmerized, I would say, or they're not confused when they do the aspect of just some numbers alone. And two, these numbers itself are not indicative of the health of the customer. Individual having all their parameters under normal, but with a subsequent amount of parasympathesis of their analytics, can also derive that they're not in the right health conditions, which means a fit person is not a healthy person, and vice versa. My next point was about engaged patients and their family members. So very often, which we get to see, the concern. As a cultural country, the way we are, very often, if anybody is asked that, how your health is, how you are keeping, foremost answers are, I'm fine. But if the same is asked about your family members, whether it be your parents, your wife, your brother, your children, defined answers with respect to what is happening wrong or what kind of problems are there. Highlighting this point is because we are going by our Vasubha, which is not only just for our foreigners coming in. That's a cultural part where we think that ourselves are less important and the people around us are more important. That's why the patients and the family members are actually much more concerned. So this engaging patients which are empowered to participate in their care and participate in the decision-making process about the goals which are related to the diagnosis, pre and post care. And the families can also engage at the organizational level through participation in various kind of quality improvement teams, wherein somebody can suggest collectively over the point of time, be it from a block or a district or an area level, that what are the challenges collectively they are facing, because we have often seen this thing as an occurrence in that prevalent diseases occur across in a district level where some significant amount of similar cases of diseases originate. So this would help us focus towards those centers of diagnostics drive to develop competencies in those kind of tests rather than having inventory which is always not consumed. It's almost like we know what the consumer wants and how we are going to handle this. The next point which I had was to talk about optimizing the cognitive performance. Now, when I say this is actually supporting the process of the clinical reasoning, which is including the integration of knowledge, information derived from the patient or the family members and the care team members. And this also includes the effective clinical decisions, the educative and the foster clinical expertise. In this process, what happens when we reach across to a mass level of population, there is a it is almost kind of a very simple kind of a questionnaire which can also be brought in, and then we get an element of data to understand the state or the alertness or the probably the the condition or the situations prevalent. A family X who probably need for a person diagnostic service for some kind of test to be done. Has an average, say, you might say, average life situation, which is kind of healthy generally. It might have been a reason something happened of late, by the virtue of which, after reflection for which this diagnosis and the diagnostic tests are getting a very different kind of, I would say, irrelevant results. And which are giving kind of impact factors which are kind of concerning. That may not be the state of the family, but that can be due to some kind of a situational results which is arising out of it. So therefore, a pre and a post to compound to this helps in the process. Also, once this information goes to the respective consultant or the decision maker who is setting up a treatment plan for them, it makes their life a lot easier to take the decision on basis of what information they have got, what kind of situations which has led to this, and therefore the next cognitive treatment advices are also at the same point of time much more structured. And most importantly is the robust learning systems. This is a structure which we need to create within our network of diagnostics all across in the country. And this is not something which probably, the key diagnostic players in the country should hold on to themselves. There has to be a system of transferring knowledge along with the team to support organizational and best practices learning to other diagnostic partners. Because when it comes to health, it's not about which is the best in health. It's about making sure that everybody has the best health. Way, and that too, once again, thanks to this platform who is bringing this entire diagnostics arm under the one single umbrella. And therefore, I'm taking this liberty to address that we should start thinking collectively in a very different manner, where we don't just, I am building up my organizational best practices just to make sure that I am the best diagnostic service provider in the country. There are a lot many things which leads to root cause analysis, diagnostic error methods, elimination of performance. So all these things can be improved significantly through measures of creating and retaining the transfer of knowledge, and from the learning improvement point of view. So we do on our technological upgradations, we continue to enhance upon our reach and access. These five should make the core of what this serviceability should offer as a part of its offering. Technology interventions can target a single driver, honestly speaking, but typically we have a way greater impact and effectiveness when they address multiple drivers. For example, technology that increases patient, family, and the caregivers' access to clinical documentation enhances the quality and significantly the output.
Thank you, Mr. Chatterjee. When I posed this question to you, I was not actually imagining all those dimensions. Technology usually feels as if there is no human face to it. But then what you talked about is the humanization of technology-driven diagnostics. So you touched upon socio-cultural determinants, and you also touched upon a bit of information management, behavior management, and then moving everyone in a very concerted, coherent way. So that's how possibly leadership has to look at it when it comes to expanding technology for everyone in the diagnostic space. Thank you so much. I'd now move on to Mr. Chauhan. So taking cues from what has just been narrated by the previous speakers, what role do you see for technology leaders in building the digital diagnostics ecosystem in India and beyond?
Thank you, Dr. Mohapatra, and the eminent panelists for being me here. And I'm really feeling very pride that we are talking about the technology role in diagnostics and technology implementation. Otherwise, if you look at that a few years back, there was a lot of gap was there between the medicine or in the healthcare system and the technology. Both were running parallelly, but they were not actually meeting well. Because of COVID, actually we got to know that it's such a large opportunity if both sectors work together can actually transform the healthcare, and which actually been proven now. And through that, and we being completely into high-end diagnostics, if you look at digital pathology was there, but the kind of adoption was very poor. But during COVID, if you look at, scan the slide, send it to the pathologist sitting anywhere in the world, get that, take his opinion, has become so easy. So technology adoption has become such an important thing, from sample pickup to the delivery of a report. Earlier, TRF need to be filled, signed, and something. Now they no touch is required. Just fill up the, our phlebotomist just collect the data from the patient directly at the patient home, and accession happens on its own, and sample processes. So that's something technology has really driven great way. The adoption, if I look at, earlier it was hardly technology adoption was 7%, now it is 38%. Though it peaked almost 56% during April, but now it's still at 38%, again, very big achievement. And if we really think about technology adoption very well, it can further scale overall healthcare system. And I believe that digitization of healthcare system is divided into three major parts. One is the digitization of therapeutics, digitization of diagnosis, and telemedicine. These three major parts it has been divided. And when we are talking about diagnosis, you know, in diagnostics already, as Dr. Mahajan has said, that radiology was already using a lot of technology adoption, but still, if you look at, lot of innovation has come in that area. You look at that X-ray for DRDO, actually, you remember that DRDO also launched one app, and then you can get the report immediately through bot reporting. Same way bot reporting is happening at, in fact, through colposcopy now. Same way, in fact, breast cancer screening started. AI and ML has played such an important role that ERPR reporting for breast cancer screening can be happen through AI. So I completely echo with that technology has played a very important role. But the important thing which need to be resolved or need to be looked at for the future, the challenges is interreportability is something where data is, the patient information is very well secured in the system or not? Is the data is very well manageable? Is it that such a standard data, as Dr. Deng said, that standard data is available? And this standard data, if the data is very well placed, are we really using it well? Are we using only for ourselves? I think that is something where is a big challenge. If data is available at one place, what is happening at other place? Is there any integrated healthcare system are we trying to solve? Not yet. Lot of new findings Dr. Mahajan is giving every day, and lot of new findings other lab or core is giving every day. Is there any integration of that? CT, MRI plus NGS plus any other molecular based test? So that is where I think the future is, and it's a long way to go, that now blockchain has come in picture. You know, and if you talk about blockchain, what blockchain is going to solve? Future is going to be, that's what something is too early to talk about. But I believe that blockchain is going to help a lot about clinical trials management, where data interpretation is going to be much faster, much secure, decentralized data will be there, but patient information will not be leaked, which is where actually the technology leaders is going to help us a lot. And second thing is the big data. The big data where we are seeing, where volume is there, velocity is there, variety of the data is there. Is that, are we managing it well? Do we have that infrastructure for managing the data? That is where area, where actually we have outdated technologies. Sometimes we are still actually working on outdated techs. So that is again an opportunity that we need to increase our IT team, and maybe more of, I'll say, and in fact, infrastructure need to be reviewed completely, because pushing only reviewing your existing IT will not help. Probably need to think about bringing new technologies in the system is going to be very, very important. And if we look at data security is one of a major concern, where data security, if we look at, if we can take that very seriously, that data security, though there are a lot of now rules and regulations being not that stringent, so can be used well, but still a lot of cyber attacks are happening on data, and a lot of companies are paid huge about solving that. So that is an area which probably tech leaders we need help from, that if they can solve these challenges will be extremely useful. And these are the few major challenges which I look at that data or technology leaders are going to help. Otherwise, I would like to say that because of pandemic, we know that human tendency is that we push ourselves best only in difficult situation, and which is we have proved. Like Dr. Mahajan said, I would like to tell you a small story. PCR was probably not aware. People were not aware what is PCR. Today, it has become the third most spoken word actually. Okay, Coca-Cola, and then it has become PCR. Once it was a newspaper, only by mistake, one big company has put up, only get your RT-PCR test done. That was only technology. Test name was not there. But still people know RT-PCR means COVID. No, that's not true. So technology has become so adopted. Okay, see, in difficult situation, it was adopted so well. So it is, so the learning is great opportunity for adoption of technology, but we have to scale it up. So during COVID, we have solved it. We have seriously solved it. We are such a competent country we are. But are we going to solve it for other diseases? So it is a next step. Let's take that advantage. Why we should get into the difficult situation? We are sitting on volcano of diabetes, cancer, cervical cancer, breast cancer, many diseases. If we can solve that problem through the learning of those, actually our country can become much better what we are doing right now. So let's solve these challenges, and that is what I would like to conclude. Thank you so much for inviting me here. This is an extremely useful discussion.
Thank you, Mr. Chauhan. You touched upon issues which were not discussed in this webinar yet. And of course, both, like all of you have been highlighting that information percolation and that to managing that information, the way it has been synthesized by the society, the communities is important. But of course, this is very empowering for the people as well. So some buzzwords have come up, some tech adaptation has happened, adoption has happened, and has been happening very rapidly. One such empowering element has been highlighted by all of you is of digitization and in diagnostics, in remote patient monitoring, telemedicine, and of course, payments. I had come to Mr. Ramesh. Sir, you have noted, like you are in the a leader in this digital payments ecosystem. So how do you see this landscape? And do you see that it is impacting transformation? Is it improving proficiency? And what all other attributes have been there through this digitization payments in healthcare? I request you to be brief because we are already overshooting timelines, sir. But of course,
sure, Dr. Mahapatra. I'll keep it brief. And as I see the impact of digital payments, essentially I'll answer this in two parts. One is how are digital payments playing, a critical role in driving efficiency and scale in the diagnostic industry, and how can digital payments act as a facilitator to support new business models, right? And some of those were discussed right here by the eminent panel speakers. So if you look at from driving business efficiency, I think as processes go digital, manual intervention is minimal. This helps in scaling up, which we all know, and with a limited addition, we can actually scale up and provide more services to a larger set of our citizens. And so it increases reach. Now, what we can do is during the pandemic, and we've been very successful in providing many of the diagnostic labs with digital payments, the ability to collect a sample and also collect a payment, because that's crucial. At the end of the day, you're offering a service, you're a for-profit organization, you need to be able to collect your money so as to be able to provide the service. So we've worked with quite a few diagnostic centers, transform their, operations, provide a payment platform so that they could, collect money from patients who had to, do the test. Whether it be through a simple, text message that comes, you click on it and you make a payment, or if you're going for some other test to the diagnostic center, you provide a POS terminal, a point of sale terminal, and you can swipe a card and pay for the same. Right? So both ways, so whether it's a home visit or you are able to visit the center, you're able to make payments. The second one is again to support new business models, and I think Dr. Dan talked about it. It's not just about curing sick patients, but also the wellness part. How do you, start ensuring that the population as a whole, using wearables and everything, remains more healthy than sick. When it's sick, you have to go get a test done. So this is leading to new business models in the country. There are quite a few startups that Dr. Arjun talked about who are working with people to keep them fit and keep them, active, keep them healthy. And so those are new business models. And those are areas, again, which are digitally driven, and hence digital payment collection becomes an important part of the entire ecosystem. So we are able to, provide, in both cases, whether it's sample collection and testing, the ability to collect the payments digitally, as well as for the new business models. You have the ability to price yourself correctly and be able to run a sustainable business and collect payments on time.
Thank you, Mr. Ramesh, for bringing this business model and then startup comment into this digitization discourse. Thank you so much, everyone, for your inputs. Before we conclude, I take up this opportunity for one short concluding statement from each of you. Let's start with Dr. Mahajan. Sir, your remark.
Thank you very much. I would say that India is poised to become digital with both the private as well as the government sector, jockeying and also working together. And I think the universal health identity that's going to get created is only going to make this easier, and transportability of data across these lines will make life much, much easier, both for the patients as well as for doctors.
Thank you, sir. Dr. Dang.
So technology is critical, and moving forward, if we don't really embrace it, we will perish. So being doctors, we should try and understand it, embrace it, and adopt it into our daily life. Because at the end of the day, for the larger cause of the nation, it is the only way that we will deliver high impact healthcare to the country.
Yes, Mr. Chatterjee, your concluding remark.
So all I would say that, as we continue this journey of enhancement, upgradation, and expansion of our healthcare services, and most importantly of our diagnostics vertical, and be a significant contributor into our Atmanirbhar Bharat, which is the Bharat for well-being. The focus should be maintained on ensuring that technology drives the diagnostics quality, improving the connection in between the clinicians and patients, and in order to provide a safe, effective, and efficient care, which should be affordable without compromising upon the efficacy.
Mr. Dinesh.
So bringing data together to create better impact, better quality of results, and in fact more coverage to the patient, providing all the facilities, and in fact looking at other disease segment also to solve the problem of the nation.
Thank you, Mr. Dinesh. Mr. Ramesh, your concluding remark, please.
Yes, thank you. I think digitization is unstoppable. Creating platforms that can leverage this digitization to be able to provide services at the massive scale that our country requires is something which was absolutely required and mandatory. And third, from a private sector perspective, monetization of these platforms that they're able to create and being able to collect payments for the same is equally crucial.
Thank you so much, our esteemed panelists. It's been a very wonderful 1 hour, very enlightening, very insightful, and we have touched upon several issues. I'd also like to thank our audience for being with us on this. And once again, I take this opportunity to thank one and all, and especially Worldline and ET Health World for bringing this to us. Thank you so much.
Thank you so much.
Thank you. Thank you, everyone. Bye-bye.